Hello, YouTube. It's your girl Lace Queen 511. Please consider liking this video, commenting, sharing, and subscribing to my channel. Thank you so much for clicking on this video. I hope everybody is having a good day so far. So today we have a YouTube health report, and it is regarding Arizona. So I have on the screen a video that I found, and it describes the spread of the coronavirus. And I'm covering this story because we have our first case of coronavirus in Arizona. So this case has been confirmed by the health department. And so I just wanted to touch up on this. Health officials confirmed coronavirus case in Arizona. Officials say the person infected is part of the Arizona State University community, but does not live in university housing. A person who is part of the Arizona State University community is the first in the state to be diagnosed with the coronavirus, raising the number of confirmed U.S. cases of the new pneumonia-like virus from China to 5. The Arizona Department of Health Services and Maricopa County Department of Health announced the diagnosis in a press release on Sunday. The person who was diagnosed with the novel coronavirus had recently traveled from Wuhan, China, just like the other 4 U.S. patients who have been diagnosed. Health officials wouldn't say whether the person is a student or staff member at ASU. Dr. Kara Kreis, director of the Maricopa County Department of Public Health, said the person affected had been following news of the virus and called their healthcare provider when they thought they could be impacted. That person has been in voluntary isolation since going to the doctor to keep the illness from spreading. Quote, very similar to any other type of communicable disease outbreak that we normally run, such as measles or foodborne illnesses. They will be following up with the individual that they believe are in close contacts with them. End quote. Health officials are investigating any people who may have been exposed to the virus while the person was infectious. Anyone who is identified as having been exposed will be contacted by health officials and monitored for fever and respiratory symptoms. The university said in a statement on Sunday that the individual lives in Tempe but not in university housing. Quote, ASU is working closely with Maricopa County health officials to investigate any contacts that this individual may have exposed while infectious. Those who have been exposed will be notified by either ASU or public health and given specific instructions on monitoring for symptoms. If you have not been notified, you have not been identified to be at risk of developing symptoms. End quote. So I wanted to cover this story because coronavirus is very serious. It's a RNA single-stranded virus, and to give you something to relate this virus to, it's Ebola, rabies, influenza, the common cold, Hep C and E, West Nile, polio, and the measles are all single-stranded RNA viruses. So we know that those viruses are very serious, and so is the coronavirus. So to help reduce the spread of infection, you want to wash your hands with soap and water for at least 20 minutes. Of course, use friction when you're washing your hands. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid contact with people who are sick. Stay at home if you are sick. Cover your cough or sneeze with a tissue, then immediately throw the tissue in the trash. Of course, wash your hands. Clean and disinfect frequently touched objects and surfaces. So, some signs and symptoms of having the coronavirus include runny nose, headaches, cough, sore throat, fever, excuse me, a general feeling of weakness or like feeling like you are not yourself, like you don't have any energy, you're fatigued. This incubation period can happen from 2 days to 2 weeks. And we do not have any notification on a vaccine for the coronavirus because we know with viruses, they mutate so quickly that it's hard to get a vaccine that can control the spread of it. But you should still get your flu shot anyway. Um, some of the common differences between the viral and the bacterial infections is with the bacterial infection, it enters your blood. It's a toxin, it becomes a toxin in your blood. Your body naturally just reacts to it quickly. So you might have difficulty breathing, you'll have a fever right away. When they do your labs, they can see that your white blood cell count is high. And so it's obviously there's an infection going on. With a viral infection, it's a little bit different because it enters your cell and then it starts to damage your cell. So it has all that incubation time to go in there and hang out and do what it wants to do to your cells. And before you know it, you're deathly sick. And then you've acquired SARS, which I can't even talk this morning. I'm sorry, guys. Still recovering from yesterday. But it enters your body, and then all of a sudden you have SARS, which is severe acute respiratory distress syndrome. So that means you can't breathe. You go to the hospital, they find pneumonia in your lungs. It's hard to treat you because, like I said, there is really nothing they can do but comfort. I should say restorative measures, like if you're dehydrated, then they'll give you some fluids. If you're coughing, they'll give you something to help with the cough. If you have aches and pains, of course, they'll give you medicine for that. But they do not have one particular medicine to actually give you to help the virus go away, help the virus to go away. Versus with a bacterial pneumonia, they'll give you some antibiotics, and then they can watch you get better and then send you on your way. Now you can get viral pneumonia and then bacteria pneumonia as a secondary infection. But and that is common to happen. I'm sorry, my phone went off. But yes, I just wanted to give a little bit of education on the coronavirus and to let you know that it is at Arizona State University. That was the first case, so it is around. If you have loved ones in the hospital, or if you're in the hospital, encourage your healthcare team to wash their hands before they touch you. If you have a loved one in there, make sure they are washing their hands and using gloves. I don't care if they just want to touch around the bed or if they just want to grab something. If it's close to your loved one or to yourself, say I would feel more comfortable if you put on gloves or wash your hands. Don't let them interact directly with the patients or with your loved one, I should say, or yourself without washing their hands, because like I said, the incubation time is anywhere from 2 days to 2 weeks. So it could already be in your body and just not manifest just yet to where, it's severe. Look, I really know what I'm talking about. I just cannot think today. So anyway, I'm going to stop the video right here because it went to commercial. I'll leave the description for this other video in the description box. I'll leave the link. So thank you for watching this video. It's your girl, Lace Queen 511. Please have a best day and blessed day. I'll talk to you soon. Bye.